I agree. And it's always like an unconscious neglect, right? Like so many times, I know you probably have the same as me when we're working with people and you ask them how they're doing, like how their mental health is doing, how their stress, anxiety is doing. And a lot of people will just be like, oh, I'm fine, and kind of brush it off. And I think it's because they fully don't understand the impact of why we're asking this and why it's important. Because like Andrea said, if you're not doing very well, like mentally, like if we're struggling with stress, we're struggling with depression, anything, how are you expected to be successful in taking meds properly, doing finger pokes, going for all these appointments, just having this list of to dos, right?
Hello, everyone. Welcome back to another episode of A Plate Full of Insights. For today's episode, we will be focusing on the realities of living with diabetes, which is the theme this year for Diabetes Canada's advocacy campaign. And joining me today are two registered dietitians and certified diabetes educators that work here at Revive Wellness. Would you both like to introduce yourself, starting with Kaylee?
Hi, my name is Kaylee. I'm a dietitian and diabetes educator with Revive. And with me is Andrea.
Hi, I'm Andrea. I am, dietitian and diabetes educator. Because this is what we're, talking about. Both Kaylee and I are diabetes educators, which is why we're both very excited to be talking on this topic today. But what I think it should be awesome is a lot of people don't know what a diabetes educator is. So, Kaylee, maybe we should start there and talk about who are we? Why, this fancy title? What does it mean actually?
Fair enough. I find a lot of people do get confused when I say I'm a dietitian and a diabetes educator. They always look at me like, what's the difference? So I guess we can start there. Like a dietitian, most people know we do 4 years university, we do an undergrad degree, we focus in everything food. But with an extra diabetes educator license, this is just extra training specifically around diabetes. So, Andrea and I have spent many, many hours studying everything around diabetes, around different ways that we can manage diabetes, different ways we can treat it.
And I think even to add into that, Keely, is, it makes a really big difference with people who we're talking about or talking with who are living with diabetes to be able to add on a lot more around the management and the frustrations that come with it, which we're going to talk about today too. So we come with a bit more of that broader ability to chat about all things that people are dealing with, living with, that you might not get if you just went to another healthcare professional.
Absolutely. You get like that extra step of care or that extra, just more. I agree.
Yes, so I'm very glad to have this extra level of experience and expertise focused on diabetes for today's episode. And where we can begin is broadly going over the theme that I mentioned today that Diabetes Canada has this year. They are calling it Spill the Diabetes, which is about discussing the realities of living with diabetes. And as both of you have more in depth experience and knowledge on this, where would you like to start with what you think is most important for people to know when it comes to the realities and the daily management when it comes to living with diabetes?
I can start in, and I think it's important that we start at the beginning of just even receiving that diagnosis. You go in to see your healthcare professional, and all of a sudden now they're saying something's popped up in the blood work, and now you've got this, and now we got to be doing, eating better, moving better, or blood sugar testing or medications. And all of a sudden you're sitting there going, whoa, just kind of came in based on blood work. And I think that's the moment of time where that is a lot to take in just in that one appointment of not fully understanding what it is, what this means, what the day-to-day living looks like. So I think for a lot of our clients, and Kaylee can expand on this too, of that first appointment for somebody is can feel like a bomb is dropped. It's a very overwhelming experience for a lot of our clients. And that's, I think, the first piece of that's where it just keeps going. The realities and living with it all start with that one appointment. But what do you think, Kaylee?
I agree. That one overwhelming appointment. I mean, so many people have told me that as soon as their doctor says they have diabetes, they just freeze and they don't even hear anything else, right? It just goes out the window because they're just so overwhelmed and they're kind of running through that. How could this have happened? Why me? What can I do about this? And it's just a shock factor.
Yeah. A lot of emotions come with it too, right? Of acceptance, the why me, what did I do? How did I get here? What needs to be done? A lot of clients leave those appointments, yeah, not hearing anything, or all of a sudden being like, here's a prescription. All of a sudden now you got to take medications. Oh, I've never done that before. Or you know what? Now you got to go and start poking your finger or wear a sensor. Oh, like I've never done that before. So it's information plus, and all of a sudden, a trajectory of a whole bunch of new skills and information to come. Um, yeah, all all at once, all at once. And I would even argue that even for any of our listeners who maybe might not be just newly diagnosed, but maybe who have been living with it for quite some time, these feelings still are also there, right? Oh my gosh, medication changes, go in and something has progressed or changed, and all of a sudden new waves of information are coming. So I think that's important for listeners to know of. We know that there's a lot that comes from that appointment, and it's okay to have all the feels attached to it.
And the sad thing is it's a 15-minute appointment usually with your doctor, so it all comes at once, and then you're left on your own thinking, "What do I do?" Right? And I think for anyone, the first step is they go home and they're just trying to understand, like, how could this have happened? They're trying to process it, step 1, before they can even think about what to do, like, actually with my diet and how to take medications and how to take them properly, and like the first step is just accepting the diagnosis and processing it.
And I also think even, we think about the realities too of you go to the appointment, go home, start processing it, but maybe there's a loved one, family and friends, and all of a sudden you send them in, oh, what does this mean? What does this mean for our home? What does this mean for, what we need to do, right? So there can also be that secondary impact on a diagnosis.
Yes. I mean, I think we've seen it many times too, where we have loved ones or partners coming to our sessions because they do all the cooking or they're helping someone with taking insulin or taking their medications. So it's not just a one person like situation. The whole family gets brought in, friends, everyone.
Yeah. And this for some people, living, and I know we're definitely focusing on diabetes today, but this really is a theme with any chronic condition of sometimes that support can be really helpful, but sometimes it can also be alter that relationship in some way of, oh, now I need to cook for you differently because you're different. So it all of a sudden for some people can feel like they've got this label. A lot of my clients, we talk about, it's a club that, what, I never wanted to be signed up for, but now have a lifetime membership to. And people do feel differently, and it can impact that relationship component.
I think the biggest thing about what you said, Andrea, is it is a lifetime component, right? It's going to be forever. That's the thing that I think a lot of people really struggle hearing is There's not a cure for diabetes. You're gonna have this chronic disease forever, and it's about just managing it the best you can. And I feel like if anything, that's the hardest thing for people to hear.
Yeah. It's, I think, there's if you go into social media nowadays, especially if you go home and you've got a diagnosis, you're quickly Google searching, like, what do I do? How can I fix this? And all of a sudden ads are popping up, do this in, 30 days and it's going to be solved. And there's kind of the should probably preface is I know both Kaylee and I have a lot of hope. There's lots that you can do, and we're going to talk about that too. But there's also this sense kind of false hope out there that kind of can prey on people who are very vulnerable, very new in their diagnosis. Um, Alongside of that, I don't know if I explained that very well, or Kaylee can add to that train of thought that I was on.
No, you did. You did. I feel like every single person has turned to Doctor Google many times. I think we all have. Even the 3 of us can admit we've done it. And so every single person, when they're first diagnosed, they don't hear what their doctor says. They don't hear any of that first appointment. So they go looking for answers. And the problem is a lot of things that we find online are just not good sources and not good resources. And they do really set people up to not be successful.
Yeah, and that's, one of the things I know we tell our clients too, and we've talked about this in other podcast episodes too, of, that's something to watch for, is to look for, does this sound too good to be true? And to stop and pause and go, does this sound right? Or, kind of double checking, where is this information coming from? And I know that still feeds into having to do work and having to look into and learn more about um, living with diabetes. And that's one of the things I talk to my clients a lot about is, before we do all of the things that maybe think we're supposed to do, we got to understand what it is and what it isn't. So we can kind of start breaking down those barriers a little bit, especially to your point, Kaylee, too, of like the self-blame. I think that's a huge one that people carry. So just talking about that even is really important.
I know everyone always seems to think it's our fault, and we don't realize that there's so many things we can't control, like our genetics. If your parents have diabetes, you're probably going to get it sometime in your life, and that's a fact. As we get older, your body changes. Like there's certain things we can't control, and I think a lot of people just put all their eggs in the basket of I did this to myself because, I wasn't eating properly or I wasn't taking care of myself, and it's really hard to kind of explain to them that no, that's not how this actually works. Yes, we can change our diet and yes, we can manage the diabetes better, but it's not your fault and it's okay.
Yeah. Yeah. I would agree with that.
So the key things that we want to emphasize at the first part here, like you said, is that with whether it be diabetes or any other chronic condition, it is normal to feel a mix of emotions initially after hearing the diagnosis, after first just getting used to things. And I feel that that is an underemphasized aspect of a lot of chronic disease management or education or the care that you receive for it, where a lot of the focus is here's your diagnosis, here are the things that we all the things that we want you to do, but initially that can be an extremely hard thing just to accept before we get onto that. And if we do want to manage more of that mental health side of things that comes along with this, what are some ways that we can try to do that?
Um, I think, and I know Kaylee would agree with me, is the mental health aspect is, amongst all the diagnoses and all of that, it's the one area that for many different reasons that we don't talk about, we don't think about, or we underestimate the impact of our mental wellness on our ability to navigate and manage a chronic condition like diabetes. Um, to me, when I'm working with clients, they go hand in hand, because if mental health, if we're not doing really well, then trying to add on new behaviors and learn new behaviors and trying to take on new things is incredibly difficult. So if we are neglecting that area or not taking a moment to stop and reflect of, like, how am I feeling? What am I really thinking about here? What are these thoughts that are starting to pop up? Then it just makes everything more difficult and more challenging. What do you think, Kaylee?
I agree. And it's always like an unconscious neglect, right? Like so many times, I know you probably have the same as me when we're working with people and you ask them how they're doing, like how their mental health is doing, how their stress, anxiety is doing. And a lot of people will just be like, oh, I'm fine, and kind of brush it off. And I think it's because they fully don't understand the impact of why we're asking this and why it's important. Because like Andrea said, if you're not doing very well, like mentally, like if we're struggling with stress, we're struggling with depression, anything, how are you expected to be successful in taking meds properly, doing finger pokes, going for all these appointments, just having this list of to dos, right?
Yeah. And I think, it even has, and the stats are there. We know that for people living with diabetes, that we are 2 to 3 times more likely to develop more mental health conditions like, depression or anxiety or trauma or even substance abuse, eating disorders, specifically just around that. So it is something that should be talked about as part of your regular care. If somebody is not asking, if you're going to somebody and they're not asking, you should tell them. You should be like, hey, you know what? This is hard. And I'm really struggling. And you know what? I'm not sleeping and I'm finding everything to be really difficult. And saying that out loud can be incredibly empowering for somebody versus holding it all in, because especially for people like Kaylee and I as diabetes educators, is like, okay, this person is really there's a lot going on and they're very overwhelmed. Like, what can we do to help? Like, what can we offload? How do we make this easier? What can we do to offload some of that burden? But if we never say it out loud, we never know that those issues are showing up. And one of the terms for, that Kaylee and I hear often, we talk to our clients about, and I'm going to get Kaylee to kind of explain it, is, we might go, oh, no, I don't feel depressed, or, you know what, I don't think that's what it is, but I'm really struggling over here. And there's this fabulous term called diabetes distress, which I don't know if I can enjoy that term, but I find that term to be very helpful when talking with clients, because it puts it in big perspective of what's going on.
It does. And to kind of explain like distress is really just you're frustrated, you're stressed, you're anxious, you're deflated, like any of those synonyms around managing your diabetes, right? You're exhausted, you're fatigued, you're worn out. And I find a lot of times working with people one on one, diabetes distress is the number one barrier that I see with people. They come and they're not successful with their goals, and they always say, well, Kaylee, I'm just not motivated. And I'm like, is it that you're not motivated, or are you just exhausted? Are you just stressed out? Like, is it diabetes distress? And do we need to acknowledge this and then talk about it?
Yeah. And it can show up really as something simple as, oh, I just don't feel like going in to get my blood work. Oh, I just don't feel like going to my appointments today. Or like, it can show up as something as subtle as that. And it's where, if you're starting to see these patterns, like, oh, like, why am I feeling like that? Right. That speaks to all those emotions that Kelly, you were talking about, right? Of frustration or, even denial or fear. Maybe you're fearful of seeing the numbers. I have a lot of clients who don't want to see the numbers. There's a fear attached to that. So it might not look like what we think depression or anxiety would look like. It can look really different of just, oh, I don't feel like going, doing activity anymore. I'm just gonna sit. Or it can show up, I just am not sleeping. Like it could even show up as something as simple as that, or racing thoughts, or just even over obsessing thoughts. Like, should I eat this banana, not eat this banana? What happens if I eat this banana? Um, it's those simple things that really start to add up and take a mental toll on somebody.
Big mental toll. Like, just think about everything you just said, like all those extra thoughts. And that's somebody that is living with diabetes every single day. Like, just kind of imagine and take time to appreciate how much time you guys are spending thinking about your diabetes and how can I do things different? How can I manage it better? Um, you know, Andrea and I were talking earlier, there is so much time spent in a day just around diabetes. I have read papers that say, on average, 4 hours out of your day, you're spent thinking about diabetes. And when you think about there only being 24 hours in a day, that's a big chunk of time that you're thinking about, okay, I need to take my meds. I need to check my blood sugars before the meal and 2 hours after. I need to exercise. I have all these things going through my head and they can pile up.
I was That number just threw me because, yeah, sometimes we're grappling with, can we find 20 minutes of a day to, get our walk in? Like that's just 4 hours from diabetes management. That's not even including all of the other day-to-day things that we're supposed to do, right? Which apparently hold a job and, maybe take care of kids or, foster relationships and things. That's not even going into those areas that we also need to keep managing just for overall lifestyle and well-being. So that's a lot. That's a lot.
And I think that's why diabetes distress is more common than people will think. Like, everyone's going to experience it at least once in their life, if not many times again and again. Because if you're thinking about diabetes for 4 hours a day, every day, like, how can you not get overwhelmed or exhausted?
Yeah. And I think that speaks to one of the things, I always tell my clients is you need to say that out loud. You need to validate how hard it is, because if you're coming into this going, "Oh, like I just need to do this and this," we're gonna be missing out on all of those other pieces that, kind of need to be mindful of. So the kind of tell my clients, these are just the surface things like, oh yeah, okay, the activity and all that, but there's those other pieces that we really have to be mindful of and watching for and paying attention to, because they're the ones that creep up. Um, in the longer game, right? I don't know if Kaylee sees this with our clients, but I do with mine. Like a diagnosis, we all of a sudden go into honeymoon phase. Oh, we got this, and we got this figured out, and we're doing really well. And all of a sudden, life sets in, and then something different changes with work or life or vacation. It's like, well, I don't know how to manage that, and then that can send another big distress up of like, well, I don't know how to manage it long term.
Don't know how to manage it, or I've had many people tell me, "I just would like to take a break from having diabetes," or "I'd like a day off." And it's really hard hearing that when there is no days off, there is no breaks. It's just about trying to do small things every day to be successful, and that's hard, and it's not easy, and I can't imagine what that's like hearing that, right?
So, with all of these responsibilities and things that need to be that are forced on someone that they have to do, what are some things that we can do to try to make this somewhat less overwhelming or easier to manage in some way?
I'm a big believer of just take it one step at a time, and that's what I always tell people is let's just set one goal. So many people are coming to me and they're like, "I wanna change everything. I wanna take my meds properly. I wanna wear a CGM and know how to use it, and I wanna do this and this," and it's just too much, and I find that's sometimes where we have problems. So I've always believed, let's just start with one thing, like one goal, let's master it, and then let's take that next step just to really make sure that the changes that we're making are lifelong and sustainable for us, right? We're not committing more than 4 hours a day, just that amount of time, no extra, because there's no more hours left in your day.
Yeah. I wholeheartedly believe in that one too of, um, there's a lot of noise that comes with living with a chronic condition, and a lot of noise, multiple things you can do. We've already talked about it, right? You can Google lots of things. But we forget that every single one of those things is a new behavior to learn and to iron out and to figure out the steps. How is that going to navigate to your own life? And, we talk about, you know, living with diabetes and managing it, but it shouldn't be, I can't think of the phrase. Kaylee, can you think of it? Like, it shouldn't be taking over your life either. It should be, how does this fit into what I'm doing? Not needing to make 360 changes. A lot of the things that we can do, small things, have a really big long-term impact. We do not need to, do a huge overhaul to see health benefits, improvement of management. And I think that's what we forget is we still need to be us at the end of this, or who you are. It's not supposed to change that. It's living well with it, but it's not taking over your life either.
Absolutely. And it's doing what we are able to do, right? We're not always able to do everything. For example, I have patients come to me that have mobility issues and they're like, but I want to exercise. Well, maybe right now we can't do that. And that is okay because, exercise is just one tool, but nutrition, taking your meds, seeing a psychologist or a counselor, talking about mental health, all of these are other tools. And I think I use this expression with everyone is that we have to have a good toolbox. We have to have a good toolkit of, our friends, our healthcare professionals, nutrition, everything. And we can pull on a different tool every day as needed, right?
Yeah. And I think that even kind of speaks to, focus on what you are able to do, what's in your control, and letting go of any perceived expectations that are out there, right? Because that's also what comes with living a chronic condition. So and so's family member says you need to be doing this, and this person says you need to be doing this. And then that built-in notion of, oh, like I need to be doing all of this can feed into that. So letting go of that and just focusing on, what is in our control, what's in our control right now. It can change too. Also know that living with a health condition changes day to day, month to month. Um, and that's okay too, right? We are evolving as people. So it makes sense that health conditions should change alongside of you and what's going on.
Absolutely.
One of the things I think, and Kelly, you were kind of touching on this, and I touch a lot with my clients on this, is building a great support network, pulling from people in your circle who are gonna support you, who can be that person that will listen to those things, right? Listen to the frustrations, be that supportive ear for you. That's also what you're looking for in a healthcare professional too. Are you being heard? Are they trying to help navigate this? This can look into, dietitians and diabetes educators. This could be nurses. This could be doctors. This is your pharmacist, to go in. I'm struggling with my medications. Like help me figure this out. Um, Building a support network is really a big thing. You should not be doing this alone, nor is this meant to be something that you're walking alone. This should have people to support you through this.
And then just to add to that, just being like totally honest with all your support. Like, you're going to get out of your appointment what you give, right? So if you're 100% honest saying, "You know what, Kaylee, this is not realistic for me." I'm going to say, "Thank you for telling me that. Like I really appreciate that. Like let's kind of talk about what can be realistic for you so that you have the best success."
Yeah. There's another really big part too of that is which kind of flips a little bit is when you get things kind of figured out and you're navigating it, that self-management aspect, because we do know that, yeah, it is another job on top of the other jobs that we carry. But the more you understand it in the morning, the more you use the tools, right? In Kaylee's toolbox that she's talking about, the better then you're able to go, oh, you know what, this doesn't feel right all of a sudden. Like, what can I do? I need to reach out to somebody because, part of my care plan or what I was doing isn't working anymore. So you're also a big driver of what what's happening or how to control that health. And I think, we kind of forget that too, right? Of people living with health condition, they know it the best. They can do a lot of, hey, this isn't working, this is. And 100% to Kaylee's point of go into appointment more prepared and honest, then that helps us help you figure out a lot of those issues as well.
Yeah, those are some excellent and insightful tips. And we're hoping that even if it's just one piece there or many more, something
Yeah.
there stood out to you and may be helpful in with your own journey or supporting someone else living with diabetes. Are there any final thoughts anyone would like to finish off with?
Only thing I'll say is just progress, not perfection. Like, take it one day at a time. You're doing a lot better than you think you are. It's the only thing. Just remember that.
I would say you're not alone. So, reach out to groups, to people, to community supports, to help navigate that, as well as acknowledging this is hard and that's okay. And it's okay to have all the feels that come with it. And then knowing when to reach out to get help. And I'm big advocate of, you know what, we can see psychologists or mental health clinicians or trying to think of some other terms for them, but behavioral health consultants on if any of these things are showing up for you in any form or something feels off, just reach out. That I think follows really well with this theme of the realities of it, and a big one that we're forgetting.
Thank you both for joining me today. It's been great learning more about what the daily reality can be like and things that people may not be aware of that others are experiencing when it comes to living with diabetes or other chronic conditions. Thank you, everyone, for watching and listening. We hope to see you back for our next episode, which will also be discussing diabetes. This will be more focused on nutrition tips for those living with diabetes, featuring our chef, Lisa. So stay tuned for next week. And thank you very much for watching and listening this week. Bye.
Bye.